Yes, yes, we
Yes.
are. We are in it, I believe,
Yeah.
because the only other things I've got is to stop it or to pause it.
Your voice goes in and out. It's interesting.
I don't know what to tell you.
I'm not gonna blow my background.
Speakers, original sound for musicians on. Uh, Testing one, two, three. Testing, testing one, two, three. Your sound has been good. You have not been going out.
Yeah, now your sound is great.
Okay. All right. Okay. We are recording. Please say we were okay. We are recording now. Um, could you please introduce yourself? Tell us a bio, a small bio on yourself.
Sure. First of all, hi Dom.
Hi.
Hi, thanks. This it's really nice to talk to you like this. So my name is Ellie Davis, and I have been doing body work or healing work since well, officially since 1993. Um, I guess I call myself, I don't really like to use the word massage therapist because that's such a small term. Massage is one of the things that I use, but I also use Chinate song and some like talk, some coaching with compassionate inquiry, and then grief education. And I'm an actress sometimes and a writer sometimes. I
When
do lots of things.
well, when you in your service for massage,
Hmm.
is that the whole package? That a person who comes to you for a 30-minute massage, are you
Hmm.
giving them that package?
I mean, they're all gonna, first of all, I won't do a 30-minute massage.
Oh, well, I didn't mean to
It's
shortchange you.
too, it's so rushed. You want it's so important to be able to, I mean, we can get some stuff done, sure,
Mhm.
no doubt, but it's just so nice to have space. So in whatever time of a massage that I'm going to be giving somebody, um, yeah, everything comes as a part of it. I mean, I'm not talking during it. It's not going to be like a coaching session, but that same air of listening is going to be present. And even if I don't like Chinit song is based, it's mostly based in the abdomen, working with the abdomen. And even if I don't work with the person's like literally physically work with their abdomen, the philosophy and the method, the methods that I use with Chinit Song are still going to be part of any so-called conventional massage that I do.
Before you got into Sinead's song, what
Hmm.
style of massage were you into? Or were you into a combination?
Yeah, I think everybody does a combination, because there's so many things out there, and for one thing, it would be really boring to do just just the Swedish massage, which is what people think of, with the long strokes and you go down the back and like
Mm.
that. But also it would be boring to do just that, I think.
Mhm.
But also, everybody's body kind of asks for different things at different times. So I would say that I've always done like an integrative massage, integrating many different techniques, methods into one package.
Uh, Before the Sinead song, do you have
Hmm.
certifications and licenses for your massage work?
Well, when I started all the way back in 1993, you didn't need it. Like you would take a class if you wanted and do it. You didn't have to have all the training and the certification and licensing that you have to have now. And actually so I moved to Colorado in 95
Yeah.
and or no, 94. 94, yeah. And I I just started, I had done a program in Vermont um from 93 to 94, and I could just start doing it. And then
Mhm.
they licensing came like later in the 90s or maybe around 2000. And
Where did you get that license?
I never did. I
Oh,
just flew under the radar
hmm,
for a long time. Yeah.
really?
As I often do. I flew
Hmm.
under the radar. But again, I didn't need it then. Like I sort of got grandfathered in Colorado. And then when I moved back to Iowa last May, uh, then I needed to get a license. And that was quite a task, let's just say.
Did you clear it in the end?
In the end, I did clear it. It took 5 months, thanks to the great state of bureaucracy that we're currently in. Um, yeah, it took 5 months. What should have taken 2 weeks took 5 months because my training is so different from what they ask for in Iowa.
Hmm.
And so I had to people wrote letters for me, and it was nuts. But I fought for it. I got it. At the hearing, the lawyer for the state was even like, "I'm really impressed by you." So
Well, then, so to be clear, you
Mhm.
are you are licensed or
I'm a
you are
licensed massage therapist, yeah,
for Iowa.
for Iowa.
You say that the whole package again, that you are a licensed
I'm a
massage.
licensed massage therapist, yeah. And so that covers Chinetsang. So to be able to practice Chinetsang here in Iowa, I have to have a massage license.
Oh,
hmm
okay. Um, Regarding Chinette Song as would you call it a practice, a therapy? How do you describe it?
I would call it a practice.
Uh,
Yeah, I like to
in
call
that
it a practice.
practice,
hmm
how do you describe it?
I describe it as well, let's see, nutshell. It's from the same root as acupuncture. So it's 5 elements, it's Taoist medicine. And rather than using needles on all the meridian points through the whole body, we use our hands and we just go directly to the abdomen and really work with the fascia around the organs because they're so well protected by fascia that we couldn't really directly touch the organs themselves, but we affect the organs. hmm
And now, how long have you been practicing Chinette Song?
Since 2008. Yes.
That's 6,
hmm
18 years.
Yeah.
Wow. Wow.
Yeah. Yeah.
Um, are there any certifications or licenses for that practice, like from your
There's
teacher or something?
right from my teacher, we have certification. Like every time we get to a new level, we get a certification. Yeah. And there's always, I mean, that's a lifetime of learning that work. When you work with when you're going to somebody's abdomen, when you're working with somebody's belly, you're really working with the deepest, most vulnerable part of the person,
Mm.
so that's a continuous learning and deepening and softening. I mean, there's so much nuance in it, you know.
So, when you're working with a client, they are on their
hmm
back, and then you probe with your fingers in the abdomen area.
hmm and I mean, it's a combined thing, um because we're opening their breath, working, um, the client is using their breath,
Mm,
unless of course if they need to fall asleep, then that takes precedence because when they sleep, when they're
mm,
that relaxed, that's when real deep healing, real changes can happen in their system.
okay.
But while they're awake, what is most advantageous is if they're breathing with their whole diaphragm. So we work with opening the breath, and then they actually carry that with them, and they work with their breath. They work with themselves between sessions.
Do you have any examples or anecdotes um, from you working on your clients using Chinetsang? Like they came to you with certain issues and maladies, and after that, they seem to breathe better or stand straighter or something like
Mm,
that. Do you have examples of that?
sure. I have a few. Well, there's one, he'll remain nameless, but he's a very famous actor.
Oh, well.
Yeah, yeah. And there's a technique that we work with the spine as well, right? That using Chinetsang working on the spine. And so he came to me, I mean, he was exhausted from traveling, but there was also he had a vertebra that was like extremely distended. And um anyways, we did two sessions, and after the first session, and it was working both with the belly and with the spine at different times in the session. After the first one, it was the that vertebra was 40% back into place.
Mm.
And after the second session, like his spine, like you never would have known that this, and when I say it was extremely out, I mean it was like if you have this spine and you got little curves here, like this vertebra was sticking out like that. I mean it was a remarkable difference.
Wow.
And his whole spine just relaxed, and there was nothing you would never have known. And I asked him how long he'd had that vertebra out, and he'd said that he'd been working, like it was from an accident when he was I think he said 14, 13 or 14.
Jeez.
And when I worked with him, he's about 64.
Mm.
Yeah, so that was a pretty profound difference. Yeah.
Didn't something was Chinette song happen with you when your master worked on you? Didn't you have something
Oh
going on?
yeah, you're exactly right. You're
Yeah.
exactly right. I had fibroids.
Whoa.
Yeah, um and I was living in Sweden at the time, and the doctor, when I went to get it just checked out, he was like, "Oh, the only way to solve this is you're gonna have to have a total hysterectomy." And I was like,
Gee.
no, I'm not. No, I'm not." And I mean, it was actually it was comical because I kept saying, "No, I'm really not." And he was like, "So the next time we meet, you'll be prepping for surgery." And I was like, "No, you're not listening because I'm not getting surgery." And he was like, "But that's the only way." And anyway, so so I got it checked, and then I was on my way to Greece for the retreat that I used to organize. And my teacher, I was the subject, or not the when
Were
he
you
was teaching the when he was teaching a
for
technique for
demonstration?
working, yeah, demonstration. I was the model, let's
Yeah.
say, for working with fibroids. And they were pronounced, they were there. He did the thing, and then and then I was doing Chinetsang on myself
Mm.
in the following days. A few weeks later, he went back to show something else about working with the uterus, because he was like, well, yours will be easier to find because the fibroids will be easy to find. And so he was, you know, moving around my abdomen, and he was like, where is it? Where's the fibroids? And he was like, what happened? And I was like, Chinetsang. So the combination of him working on me for just a couple of minutes, and then me working with myself between, like they completely disappeared, and I have not had them come back. Yeah.
Very
No
good.
hysterectomy.
Um, can you think of one more example? I just want one more.
Oh, sure. I have a couple. I have like there's lots. I mean, I've helped several couples who were trying to conceive but couldn't either conceive or carry to term. Like I've helped people who have conceived but not been able to carry to term, like have had multiple miscarriages,
Yeah.
help them carry to term using
Wow.
Chinetsang.
Wow.
And like people who are using IVF, like I've helped several lesbian couples to conceive who had been having problems with IVF.
Mm.
Um, Chinetsang helped them conceive and maintain the pregnancies.
Okay.
Um, and one woman, oh, this is good because gallbladder surgeries are getting so, I mean, just so common.
Gee.
And I will never tell anybody not to have a surgery, like if that I won't tell anybody to not do a medical procedure that the doctor is recommending. Like that's so unethical. It's not my place. But I have watched gallbladder surgeries become unnecessary after one or two sessions, and the gallstones get melted. And I was working with one woman in Stockholm, and this was it was actually funny. Um, she was preparing for the surgery, like she was, she'd been struggling with the pain, of the gallstones for a really long time. And I think we did just two sessions. And I texted her or called her a couple of weeks later to ask how the surgery had gone, um and she said that she didn't need it. But the thing that was so funny was she sounded like she was mad at me. Like she didn't need the surgery, but she was like sometimes I think people get, like they're just, oh, I was gonna have this special treatment for getting surgery and
And she
and
was
now I don't
mad
have
at
to
you?
have it. It seemed like that, but sometimes I don't know. Sometimes in Sweden, I had that, like, I don't know. Are they mad at me? Do they like? I don't know.
Oh my. Oh my. Oh, um, let me move on to the next thing. It's a sort of an extension.
Uh-huh.
You're using this training and you're providing this new service called the Feast of Love. Can you explain that? The Feast of Love.
Correct. Yes, 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 yes. So the Feast of Love is it's massage. There's two licensed massage therapists, and we go to the person's home, right? Which is, that happens a lot. In-home massages are really common and lovely. And as the couple is getting their 90-minute massage, there is the chef that we work with um, preparing their meal in the kitchen. And the thing about the meal is they're not like you're not going to the website and saying, okay, we'll have steak or chicken or we'll have vegetarian. What's happening is they have a conversation with the chef. And the woman that we're working with now, I just love. She's wonderful, and she works with um, all ranges of not only food allergies, but like cultural and religious dietary needs, and the whole shebang. Um, so they will have had a conversation regarding allergies and cultural needs and all of that, but also regarding just the taste palette, like the textures and tastes and colors that they like to have in their food. And the chef designs the perfect meal for the couple according to, and they communicate throughout. Like she designs and then checks with them to say, like, what do you think about that? You know? So She's
Uh,
preparing their perfect meal while they're getting a massage. So they just roll off the table, get into their robes, and they float down to their kitchen or their dining room and have this lavish meal set out for them. And then we all scamper off and they get to
so,
have their love.
well, um, there is that component, and I have a question about that.
Ask it.
There seems to be
Hmm.
an intimacy component to this particular. Is that, or you provide the massage, you provide the food? Intimacy is not really your issue. You don't participate.
No, we don't participate. No, 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 no. This isn't a tantric workshop or anything, nothing like that. This is just a straightforward massage. Um, and I would say
And meal,
like and
massage and meal.
meal, and a
That's it.
massage and meal. It's, you know what it is? It's about enlivening the senses.
Mm.
That's what it's all about. Because one of the other things, like I have music playlists that I send to the people. So they have like, your like quintessential R&B, like love music. But then there's like
A lot of Barry
uh
White.
oh yes, sir. And then there's like I have a jazz one. Like they'll choose, like I'll just send all four with the to the couple. So they'll have a sonic, they'll have their their oral senses enlivened as well as taste and touch. And I'm hoping that the chefs are going to be doing a lot of finger food, a lot of like um well, probably they probably wouldn't do like real Ethiopian food, where you have the injera of the bread and you scoop everything. But I think like using their hands more, I have a sense that that's what I would love to see.
Mm.
Um, you know, so all the senses are enlivened, and then they bring and it's to bring them closer together. To
Uh,
bring the couple closer together.
the well, so this goes back to that the business of intimacy. That's really
Hmm.
not your realm. You do the massage, you provide the food, thank you, and we're
Correct.
done. Whatever happens
Correct.
after that, consenting adults, that's their issue, not yours.
Correct. I'm not guaranteeing that you're going to get laid, but you'll have a much better chance. How about that?
And so there is no like non-disclosure agreements that you have to fill out because that you
No.
don't cover that.
No, 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 no. No, no.
All right, all
No,
right.
this isn't this is like the massages are absolutely non-sexual. They're the intimacy of a regular massage, but
They are an appropriate massage.
correct.
Um, this is a new service that you are providing. Yes. So do you have test cases yet, or anything?
We did one so far early on, like in January. We did our very first with a different chef. Taught me a lot. Communication is so necessary. Yeah.
Mhm. Okay.
Yeah.
Let me get into compassionate inquiry.
Yes.
Is that a massage therapy?
No.
What is
That's more
that?
like that's um that's an approach to talk therapy or coaching. And it was developed by Gabor Mate, who has become quite famous in the last decade or so. Um, so I'll explain like its origins. Like he was a before he retired, he was a medical doctor in excuse me in Vancouver, like the east side of Vancouver, which is apparently um uh, the highest rate per capita in North America for serious drug addiction.
Mm.
Yeah. And so he was seeing clients, he was seeing patients, um, and he was starting to recognize a pattern in patients, both with addiction and with like chronic life-shortening illnesses. Uh, and he understood on a deep level that what these people really needed was somebody to listen to them, as much as or more than medicines or surgeries, right? So he would make time after his long, busy day and 15 minutes for this or that. So again, he started to notice this pattern that underlying, like, it's not that pain was behind all of the addictions and behind a lot of the, and probably all, I mean, if you wanted to get really truthful, probably all of the life shortening diseases. Um, and I would say respectfully, like, I understand that just talking about our childhoods, it's that's not going to take away cancer. I get that. But finding ease within ourselves, like finding compassion towards ourselves, towards that child who didn't have anybody to talk to about the pain that they were in, you find that compassion and you find more space inside your body, and it's going to give, even in really dire circumstances, it gives more space for the person to face what they're going through, which gives ease during those really horrific times. But then when you look at addictions, like, I like how he phrases it. He says it's not why the addiction, it's why the pain, right? And so when you start to alleviate this pain that a person has been carrying for such a long time, the need for the addictive substance, and it doesn't necessarily, I should qualify that, because it's not necessarily just an addictive substance. We can have addictions to things that are supposedly good for us, like exercise or sex or food or yeah, shopping, or anything. He defines it as anything that we can't stop ourselves from doing, and we know it's gonna cause harm in some way to us, but we can't stop ourselves from doing it. So that's an addiction. So you get to the root of, like, what that tension is so deep inside the person that they're having to um cover it up, or you know ease it with some kind of an unconscious way of easing.
Compassionate inquiry, right? That's what we're
That's
talking about.
correct. Yeah.
What does resilience play in compassionate inquiry?
It's a good question. So resilience is the ability to come into our lives and face any situation that's that's happening in it, right? Um, resilience is, it's more, I believe it's more than just getting knocked down and then getting back up again. It's um maybe it's getting up again and knowing that, you know what, not taking personally the thing that happened, um not taking personally that, yeah, this painful thing happened in my life, and moving on, you know, going to the next step. That's resilience.
So compassionate, the resilience comes out of being worked on with compassionate inquiry. That's the
I would
result.
say, yeah, I would say resilience comes as a result of being compassionate with ourselves. Yeah. And
Uh,
for me, that, like, my own story, like I was rather surprised when I discovered how little compassion I had had for myself and for, pains and trauma that I had carried for so long. And when I started to open to that and to myself, I started to stand up differently in my life for sure.
Is compassionate inquiry an ongoing kind of activity, or do you provide? I do 6 sessions, uh,
I think it
and we
depends on
have
the
classes.
person. It depends on the person.
Hmm.
I wouldn't say classes, but no, it depends on the person, on their situation, on uh what they want to get, you know, if they actually have like a trajectory that they want to meet. Um, but I also don't think it can, or well, I don't think it should go on for as a lifetime. I mean, unless you enjoy it, but not as a try always trying to get somewhere. Like I don't believe that. I actually believe it's the opposite of healthy to always be having to work on something, you know. Um, I think it's high time that we stop trying so hard to work on ourselves and stop trying so hard to be so perfect. And which is interesting coming from somebody who does healing work. But we do need support at different times in our life, you know? And so for me, my job is to provide support so that a person can find that that strain of health like that's always in us. Like um there's always um the energy of life, you know, whatever it is that got us moving in the first place is still, it's always at play as long as we're alive. And so as I see it, my job is to help a person connect with that, and then they let that um snowball and become their health.
Right. I want to stop here because I have a question, and I don't know if we've got answers yet,
Okay.
because this is so new. And the
Yeah.
question is,
Yeah.
uh, do you then become a consultant? And if I hire your services, it's like for a consultation. And if I need to come back to you again, are you
Mm.
like a psychiatrist, or where,
No, I'm not like a psychiatrist. No,
the
no.
relationship is different then? You
Yeah.
are more like a consultant?
Well, I don't like, okay, so here's the thing. I'm never gonna diagnose somebody with any of the things that I do,
Mm,
you know? Um, and I fully believe in I really believe in the person's body, and actually compassionate inquiry is all about helping the person find their way back into their body in a healthy, safe way, you know, because people kind of like when they dissociate, when we dissociate, when we do the things, the addictive behaviors, it's an attempt to escape what we're really feeling, the sensations, that those uncomfortable things inside of our body, right? So my place is absolutely not to diagnose or dictate. My work is really both hands-on and verbally to hold, oh, that's such a cheesy phrase, to hold space, but it's really, but that is my job, is to be there with the person so that they know that they're not alone to face these things that are going on inside of them. And then they find out that they can do it, and they move on in their own way.
okay, I want to stress that you will not diagnose. You are not a doctor.
I am not a doctor.
Okay, good. Um, those are all my questions. Is there something that you would like to cover that we have not covered?
Um, I think, you know, this question about being a doctor, not a doctor, I love that we're actually talking about that, you know. One of the things that one of the things that I think is really important for people to know again is that no matter what is going on in our system, whether it's physical or emotional, again, as long as we're alive, there is that, there's a piece of us that's healthy and untouched, right? And um, it's my job to kind of sort through the what is lacking, you know, that's so easy, that's so obvious to find, and come to the place that is um healthy and pink and perfect, you know. And I was thinking about this the other day. I was working with somebody and I was like, yeah, that's what it, this is really what it means. There's this work called craniosacral therapy, and it was developed in the 1800s by the guy who, or it was discovered, or I don't know how you really put it, um, by the guy who started osteopathy, or one of the two. And then there's Andrew Taylor Stills. He's the really big guy behind the craniosacral therapy. And he said it's just so beautiful. I'm going to have to paraphrase, but it's just such a beautiful way of looking at um, health and helping people. He said anybody can see disease, but a real healer is going to see what's healthy and work with that.
Wow.
So that's my job, is to bring what's healthy to the surface, and the part that's healthy in us is what cleans out the disease.
Anything more to add?
I think I think that's and all she wrote. Any,
That
do you have any more questions?
no, I we have done we've exhausted what questions I have and invented a couple more that I wasn't planning on. Um, no, I appreciate your time. Thank you
Oh
very
my
much.
goodness. Yeah, I appreciate you're taking the time, Dom. Thanks so much.
All right, I'm going to stopping recording.